Welcome to Sex on the Floor podcast. This podcast was created to help educate the public about problems with sex and intimacy and how this is tied to both physical and mental aspects. Hosted by myself, Dr. Molly Hart, a passionate pelvic floor physical therapist and owner of Pelvic Balance Physical Therapy, and by Dr. Katie Schubert, a phenomenal sex therapist and owner of Cypress Wellness Center. We are here to have a good time. We're here to keep it real with you all and to educate along the way. I'm so excited for you to join us. We strive to help many relationships prosper in fun, safe, and healthy intimacy. While listening to the show, please remember that this information is not meant to diagnose or treat any medical conditions. Please speak with your medical provider for all things related to your healthcare.
Okay, welcome to Sex on the Floor. I'm Dr. Katie Schubert, and this is Dr. Molly Hart, and today we are talking about male anatomy.
Buckle up.
In the last episode, we talked about female anatomy, so if you haven't heard that, you might want to go back and listen to that one as well.
Yeah, male anatomy is pretty well known, believe it or not, because it's kind of like shoved in your face in society.
Literally.
So literally. So I don't think there's a lot that simple things that people don't understand, but we're actually going to get a little bit more nitty gritty with this, because with female anatomy, we were able to keep it simple, and we did keep it simple because we needed to. A lot of people don't know the most simple things about female anatomy. So we can get a little bit more fun, I think, and detailed today with our male anatomy. Yeah,
Absolutely. Yes.
Also, for all of you guys listening, thank you so much for your support. And we are trying to get this information out to help educate. So if you are willing to subscribe to our podcast, like and share it to your family and friends, we would absolutely love that. Of course, this might be more private. Might not be something you want to just blast on social media unless you're just really loud about your sexuality in a positive way, which kudos to you if you are. But, you can always just send it via a text message or in the messenger to your girlfriend's chat to, if you're a guy listening, feel free to send it to any of your partners. Feel free to send it to some of your male colleagues, whoever you think would benefit from listening to this. We've gotten a lot of positive feedback, and so we're hoping to just continue forward. And we love when you guys contact us and ask us questions, or there's topics you want us to cover. Send them our way. We would love to interact with you all as much as we can.
Yes.
Okay. So I'm going to start sharing my screen. We're going to start looking at some penises. I am excited. Our first picture of a penis that we have on here. For those of you listening, if you can't see it, remember you can always go on our YouTube channel to actually look at this. But let's just go over some simple anatomy here. I'm again getting these from pelvicglobal.com, and this is a wonderful it's not free. I do pay for this. It's free for me to use their images because I am a member with them. And so they created just the most beautiful anatomical pictures that we can look at that are not too scary or intimidating. So if you do want to look at these and not, feel uncomfortable by the anatomy pictures, I think this is a good way to look at them. So here we have a male. We can see, here's the perineum. Kind of start at the basics, and the rectum. So that's going to be obviously the same as our females. And the difference moving up here is that we can see the testicles, we can see the shaft of the penis, and then the glands of the penis. Urethra, which is so cool to me. The anatomy is very, very similar to us as females. This is just larger and longer, really. But the urethra for men, it's encompassed within the penis and within the glands, whereas with the clitoris for females, the clitoris sits right above the urethra, but it's the same. It's just this is encompassed within it. So it's always at the bottom. There's 3 different parts to the penis. So let me see if I can find another picture of that. I'll kind of scroll through my pictures here. Here's that picture that we showed on the females. Here's the penis and the clitoris. And so we can see how this is the exact same tissue here, right? And here's the shaft. Same as like the shaft of the clitoris. And we've got the bulbus and the crust down here. So with the penis, it's just that the urethra is encompassed within the glands. Okay, so let me look at some other pictures here. All right. When we look at the penis, something we didn't talk about with our females, which I wanted to talk about, but we focused on other stuff and ran out of time, is the pelvic floor muscles. And so I think in this picture, it's showing the frenulum. This is somebody who is not circumcised here. And that's something that we're going to get into too, is like a circumcised versus an uncircumcised penis. And we're going to talk a good amount about that because I think that's important. But something I want to hit on while we're going over the external anatomy is talking about these little pelvic floor muscles. And for men specifically, I want to talk about these superficial pelvic floor muscles because they play a huge role in erection function. And so when I say superficial pelvic floor muscles, there's 3 that I'm talking about as a pelvic floor PT. One of them, which I love to say, is called the bulbospongiosum muscle. So you can see that right here. And for those of you listening, this is a nice fat muscle that sits at the base of the penis, and it is key to erection function. The way that this muscle works, or a big part of its job, is to think about it like a band around the penis. So whenever men are dealing with erection dysfunction, sometimes they will utilize a pump to pump blood into the penis, and then they'll put a band on the base of the penis to help keep the blood flow in. So how a man achieves an erection, it's all about blood flow and then the blood not exiting the penis. So some men have a hard time maintaining an erection. That's because the blood is leaving via the dorsal vein. So that band that men will put on when they're using a pump, well, this muscle is that band, the bulbospongiosum. And so I'm saying that because if we're having pelvic floor dysfunction, then we can have a hard time maintaining an erection. So this muscle is really important for you guys sustaining that nice solid firmness to the erection with blood flow. And it goes all the way around the base and it acts like, again, like a little rubber band. You've got these other little muscles here. Were you going to say anything, Katie?
Yeah, I was. So are there simple exercises that men can do to strengthen that muscle?
You know, men don't realize that doing Kegels is so important for them for erection function. They think it's just a female thing for after babies. And I'm like, like you need to do your Kegels.
How would you explain how to do Kegels to a man?
So men, you're so lucky because you have what I call external biofeedback. So couple ways. If your penis does not have an erection, it's just sitting there, you can do a Kegel and you should see your testicles actually lift up a little bit, which is really awesome. You should also, if you put your hand on the perineum or the taint, people will call it, between the testicles and the rectum, if you put your fingers right there, you'll feel that tighten up and lift a little bit. If you have an erection, and men, I know most men have done this, when you have an erection, if you do a Kegel, it'll literally like lift the penis up. It's kind of fun. So I'm sure you all have played around with this, maybe when you're younger, hopefully for the rest of your life. Just why not have fun with the penis? I think the penis is so fun. I'm like, I really do. I know that's just the funniest thing, but it's so cool to me how little it can be and how big it can be. I'm like, how fun. No wonder why men are always touching themselves. It's like a toy. I love it. I really do feel that way about the penis. I know I'm weird. I don't know if you have any thoughts, Katie. I have lots of thoughts. Anyway,
the other that are critical in erections.
Say that again.
What are the other muscles that play a part in erections?
Yeah. So we've got this bulbospongiosum. That's one of our 3 superficial muscles. And then we've got this one called our ischiocavernosum. You can see that also goes along the base of the penis. And then we've got this superficial transverse perineal muscle, and this goes all the way across. And so it goes from the perineum to this big bone that we call the ischial tuberosity, or people in yoga will call it the sits bone. And so actually these are all attaching to that little sits bone. So that's the bone that you feel when you're sitting down. And so this one, the ischiocavernosum, is at the base of the penis to the ischial tuberosity, whereas the bulbospongiosum just goes completely around the shaft of the penis. So I will tell you, as a pelvic floor PT, I am working on these muscles. And that might be like uncomfortable to hear or to know, but if you're coming in and seeing a pelvic floor PT, more often than not, if you're working with a skilled pelvic floor PT who's comfortable working with men, and I'll tell you, not all pelvic floor PTs work on men, and not all are comfortable working with men because of the sexuality that could be placed behind it. And so this is an area that really does need to be worked on. And if it's not being addressed, we're really missing a lot as a pelvic floor PT. Men who deal with pain around the testicles and around the perineum, which is pretty common, these muscles have to be worked on. So you can tell for me, the way that they're presenting, if they're having dysfunction, I can tell whether this needs to be worked on, or if I need to do more of my focus on the deeper pelvic floor muscles that people generally think of, which is this big old muscle right here. You can see. So this is the levator ani, which is just a fancier term for pelvic floor muscle. Okay. Any questions on this, Katie, that you want to go over, or?
So the Kegels,
Yeah.
those muscles that you mentioned initially as part of, the shaft of the penis and then going down to the sits bone, the Kegels will strengthen all three of those muscles.
It strengthens all of them. And something we didn't get over to with female anatomy is we have these exact same muscles, and these exact same muscles affect clitoral function as well. And so women who are having decreased clitoral sensation, that's another part. Kegels are a part of that rehab, along with other aspects of the care. But yeah, this is really, really important to do pelvic floor exercises. Now, some men are having issues here and they need to strengthen these muscles, but this is really important for you guys listening. Sometimes you are in a hypertonic pelvic floor muscle state, meaning your pelvic floor muscle, I'm going to stop sharing, is actually too tight. And so I think I've done this example before, but I'm going to do it again on this episode, is all of these muscles on the bottom of my arm, they all control wrist flexion and finger flexion. And if my wrist is in neutral and I make a fist, I'm really strong. But if I shorten these muscles, so I'm going to shorten all this, and I try to make a fist here, not only am I not as strong, I can't even make a full fist. And it's actually very uncomfortable feeling for me to do that. And so you can have weakness in a muscle because it's too short or it's too lengthened. It doesn't necessarily mean we're in this lengthened state that I need to strengthen and make the tissues tighter. Why I'm saying that is if you're in a hypertonic state and in the short state and you start doing Kegels here, you will make your symptoms worse. So if you happen to start there and you notice your symptoms are getting worse, well, it's pretty much a good sign. Like, oh, I have a hypertonic pelvic floor. I need to go see a pelvic floor PT. And I've seen that quite a lot. And I end up doing a lot of tissue work on those men and strength training them at the same time. And I'm really helping to reprogram the way that they're using their diaphragm and their core with the pelvic floor, because men, oh my gosh, men are so bad about the way that they brace. They brace, in my mind as a PT, in a way that I don't like. They do a lot of pushing down and out when they're bracing with lifting. And so when I retrain them how to properly group the diaphragm, the core, and the pelvic floor together, their erection function skyrockets. They're like shocked. And then, of course, they come back to me and they're like, "You're amazing." And they think I'm like a goddess. And I'm like, I'm not a goddess. All I did was just teach your body how to function better, and therefore your penis is appropriately responding. So I say that just because there's different reasons why that muscle isn't working well and what we can do to fix erection function.
Yeah.
Any other follow-ups, Katie, or no?
No, I just think this is really interesting because when I get men in my office, they're usually, when they're talking about their penis, they're usually saying either I can't get erections or I ejaculate too quickly. So it's interesting that you're talking about the physiological components to erectile difficulties. And if I ask all my questions and I figure out that the erection issues aren't psychological, I send them to you. I'm wondering whether or not there are physiological components to premature ejaculation as well.
There is. So physical therapy has been used for premature ejaculation. Again, and I think we've talked about this in past episodes, is with premature ejaculation, I think even you said this, you're not going to want to use that mindful masturbation tool as much. You're almost trying to get them to not focus on that area, right?
Sometimes, yeah, depending on what.
Okay. I just think in general, when you have better control of that area of the body, better proprioceptive awareness, I call it, then in general, you're going to be able to help just control when I'm going to actually experience an orgasm. So I'm always going to focus with somebody who comes in with premature ejaculation. Normally when people come to see me with premature ejaculation, that's not why they're coming to see me. Normally it's for something totally different, and often it's because of something pain related. And then that's just something else I'm going to focus on because they're in there with me. And I'm really just focusing on them being able to have really good control and understanding of that area of the body. So they feel more in control, because we know with premature ejaculation, there's an insane amount of anxiety, right?
Yes.
Right. And so like anxiety is just the opposite of anxiety is trust. So if I start to trust my penis more and trust my body more and my ability to control it, well, that's going to decrease anxiety, and hopefully psychologically even that'll decrease the premature ejaculation anxiety component to it.
Oh, that's so true.
Yeah. So, but I think premature ejaculation, I think working with you, you would probably actually see better benefits than just working with a pelvic floor PT. Like if I had to pick between you've got premature ejaculation, work with a sex therapist or work with a pelvic floor PT, I would, if you're only going to work with one of us, I would work with a sex therapist.
Yeah. I mean, a lot of it is psychological when it comes to PE. A lot of it is also psychological when it comes to ED. I mean, as you mentioned, there can be some muscular issues, but also the way that boys and men are brought up in our society lends itself to penis issues.
Oh, yeah.
The way that men are taught or not taught and just figure out how to masturbate, how they've learned about sexuality, how they've learned about their penis, or again, how they haven't learned about any of those things, lends itself to all sorts of sexual issues later on in life.
And then there was something you said that really stuck with me, and this was in an episode forever ago, which was that, women partners can put a lot of pressure on the penis of like, when are you going to come? Or like, you need to go quicker, you go too soon. And so the word choices that we are using and the pressure we're putting on our partner about their penis. And it's sad, really, when you think about it, because that's not necessarily something you see as a problem with men to females when it comes to sexuality in the same way, but we don't have to have an organ that has to be full of blood in order to work to have sex. So, I mean, that's a lot of pressure. They like the penis has to be working in order to have sex with it. We don't really have to have that with us. So
no, but whenever you see any amount of pressure in a relationship and that pressure is applied to sexuality, it never goes well. Because it just heightened anxiety. So the whole goal of sex therapists, so we use an activity called Sensate Focus, and the whole goal is to try to remove anxiety from anything sexual in a relationship. Because once that bond is there, once that pairing of anxiety and sex is there, it's so hard to disconnect those things. And as you said, like you need to be able to trust your penis, and the best way to trust your penis is by having wins. So oftentimes men will come in and they'll say that they have erectile issues, and it's never erectile issues, right? It's always brain issues. But once I get them working on like mindful masturbation and how to have sex with their partner in a way that doesn't spike their anxiety, once they have a few wins under their belts, they do fine. They're fine. They don't have these issues until maybe they get into a new relationship and all of that anxiety floods back.
Yep. 100. Yeah, I agree with that completely. I have a male right now I'm working on doing mindful masturbation, a younger guy. And at first he came back, he's like, this is so hard. And I was like, I know. And I said, just keep practicing it. And, of course, using porn a lot, right? And I told him, I'm like, I don't care if you use porn. I go, I'm fine with that. But because you're having an issue with the erection function, let's start practicing more of the time when you masturbate with doing mindful masturbation. So that way the penis starts to learn to ejaculate in a different way without that need for that visual stimuli and whether it's in your head or whether you're looking at it. Because it's not a problem when he's masturbating, the erection dysfunction. It's just when he's normally with a female partner. And I'm like, well, yeah, because you haven't trained the penis to be in an excited state with a female partner when you're using porn all the time, which is not realistic, right? So by the third session he came in, he's like, yeah, it's really gotten easier now. And I'm like, good. So I'm like, just keep practicing.
Yeah, the way that I explain it to a lot of the men that come in, and I do get a lot of men in their 20s, 30s, 40s who say they have erectile issues, but there's no physiological thing to back up why they might have ED. So usually what I give them as homework is a lot of mindfulness activities. So I say, take a shower, pay attention to how the shower feels, wash the dishes, pay attention to how the hot water feels on your hands. Do that all day long with all of the things that you can do. When you're driving the car, turn off the radio, roll down the windows, enjoy, the wind blowing in your face. And then when you masturbate, get a good lube, make it like a very pleasant experience environmentally, and really pay attention to how it feels. Yeah. And don't rely on auditory stuff, visual stuff. Just pay attention to what the actual sensation is like, because I think I may have said this in one of our previous episodes, but when we were, 15, 16, coming into our sexuality, masturbation was easy. Like, sex was easy. The stimulation was easy because we didn't think about it. We weren't in our heads about it. The moment we get in our heads about anything with sex, it's like riding a bike. If you think too hard about it, you might fall off the bike. Yeah. We're programmed to chase positive stimulation, and if you just let your nature go, typically it'll be positive. And it also it makes masturbation a very meditative type experience, and it's so calming. Like, after you orgasm, it's just such a calming feeling. So if you've just been in that mindful space, just another good thing that we need to be doing, because most of us aren't in that calm parasympathetic state often enough. So, okay, let's, I want to go. One other word about masturbation. I tell a lot of the men in my office to switch things up. And that really applies to like the way that they're holding their penis. So I say, if you usually masturbate with your right hand with a specific grip, maybe use your right hand with a different kind of grip, or use your left hand occasionally. Like, switch it up, because penises get really acclimated to the thing that you give it all of the time. So to make sure that you're not giving it the same exact thing every single time you're, having sex by yourself, because then that's what it's going to need moving forward, even with partners. Yep. And that goes for the clitoris too. It's the same thing. It is going to be trained, but that's the whole body. The whole human body, if you train it the same way over and over and over again, it'll become very automatized in that way, which is great. It's also really important to remember the brain is a storage organ. It does not delete things. So if you want it to learn something new for the body, you have to train a new neuropathic connection repeatedly for it to strengthen that connection to where it's strong enough to where the brain will kind of naturally that pathway will take over whatever the other trained pathway was that you were using. Because you're not going to get rid of it. Like, it doesn't, I don't think you can shrink the pathway. We've shown, anatomically, physiologically, we've done studies that show you can shrink the dendrites and how the nervous system's connecting. But we need to train over and over and over again if you want the body to perform a certain way. But so cool that we can do that. I think it's amazing. So let me go to another anatomy picture here. This is just a cross-sectional view. This is stuff I wanted to go over with our female stuff that we just didn't get to, that we might do another episode on. But this is something I wanted to go over. Here's the bladder. I'm just going to orient people who are looking. The bladder sits right above the prostate. The urethra goes through the prostate. And then here you can see it's going through this spongy tissue through here. So we have it called the corpus spongiosum. Does it have it labeled? The other, yeah, here we go. And the corpus cavernosum, good, is here. So we've got two parts of, I don't want to say that. I'm going to back off. I'm trying to make sure I don't make this too complicated. So
let's just go with the urethra real quick here, coming through, and we can see, as I said, I talked about earlier, how it goes through the glans penis at the bottom here. Obviously, here's the testicle, and what's so, I think, cool and to understand about the testes is that we've got this vas deferens, which is what carries the sperm into the urethra area eventually, but it goes through here, these things called the seminal vesicles, which is really important for my pelvic pain patients who are dealing with what will be labeled as prostatitis. But working actually through this area is very important for them. But this fluid ends up getting released through here. You can see this little vessel that then connects to the urethra, and it all comes out. So your urine and the semen are all going to come out of the same tube here, which I think is kind of cool. Other things that I want to hit on with this is this vas deferens. It comes up in front of this pubic bone. So the pubic bone, everybody, if you put your hand on your low belly and you go down to the very, very low belly, you'll finally push down, you'll feel a hard bone, and that's your pubic bone. And so that vas deferens goes in front of it. And I'm saying that because when men are dealing with lower abdomen, pubic symphysis type discomfort, often this vas deferens is playing a role in it, and often we'll see left testicle discomfort associated with it. With men, right testicle pain is very indicative of a red flag, and a red flag meaning something more serious that you really want to get checked out, such as things like cancer and so forth. Left testicle pain we see more often being associated with diagnoses like epididymitis. Sometimes there can be like little cysts within the epididymis, which I've had a lot of patients who have that, and the urologists don't do anything about it. They just kind of monitor it. But something to be aware of if you're dealing with this type of testicle discomfort and just the anatomy and where it's running, and so forth. The rectum, yeah. Mm-hmm.
This is surprising me that I've never heard this before. So I always had the impression that the vas deferens ran up like the middle of the testes or the scrotum.
Yeah. You would always think it goes behind, right? Like you would think, but no, it's actually coming up, and you see how it loops around?
But why the left testy?
So I don't have an answer to this, but I will tell you clinically a pattern that I have seen my whole career is that most people who are dealing with chronic pain, it's almost always on the left side. Now, not always, but almost always, like 90% of the time. And so there's a pattern we even see with men when it's a left testicle pain, that it's more indicative of, like I said, it's really typically a pelvic floor dysfunction, but most men get diagnosed with epididymitis or prostatitis. They're thrown on rounds of antibiotics for nothing to occur. Often men don't know what to do because urologists do not refer to pelvic floor PTs except for the really good ones. And we've got some really good ones in our area. If you're looking for a good one and you're in St. Pete, message me. I'll send you to them. And the really good urologists who are up to date on the research, they do refer to pelvic floor PTs. And so I do get a handful of men that way. But often men are finding pelvic floor PT when they're dealing with these issues from like Reddit feeds and Google searches. It's like ridiculous. And I've had men who have been on so many rounds of antibiotics, they've had allergic reactions that have like ruined their life. I mean, it's really sad. It's sad that our healthcare field just doesn't understand the pelvic region as well as they need to. And that'll change, I think, with time, but we're not quite there yet. Men's pelvic health is even further behind than female pelvic health is, which is surprising, but it is. So anyways, here's this perineal membrane right here between the testes and the rectum. And you can see here's the rectum and the back side. Men don't have as much of I wonder if I have a picture of this. Men don't have as big of a pelvic opening as, here's a picture, as women do. So here you can see a frontal view of this. There's that pelvic floor muscle. This big opening is much smaller for men because they don't have to birth babies. They also don't have a vaginal opening, right? So they don't have to deal with prolapse issues like we do as women. And prolapse meaning a pelvic prolapse, meaning for us as women, bladder, cervix, uterus, and rectum. men could technically have a bladder prolapse or a rectal prolapse or something called a rectocele, but it's not as likely because they don't have the same opening size, and they don't have a vaginal canal for things to fall into. They have a rectal canal, though, that things can fall into. Okay, so if we look on here, this is a cross section of the penis, and I said there's 3 parts to it. And so these 2 top parts right here, this is what is analogous to us as females, which is this corpus cavernosum. But down here we have the corpus spongiosum that is around the urethra, right? So you can see the difference between that. So if you ever look at a male penis, you can actually see like the 3 different structures to it, the 2 at the top and the 1 on the bottom. And then you've got all this beautiful tissue around it that is really important. And this can kind of bring us into what you wanted to talk about, Katie, before we started this episode, with some male patients you're seeing with, I'm going to say it wrong. How do you say Peyronie's disease? How do you say it? Peyronie's disease. So that's because of actually a restriction within this connective tissue that we see on the outside over here. So if you want to talk a little bit about that, Katie, while we're here.
I mean, I think that you might be better suited. You know, when I see men with Peyronie's, you know, there's a wide spectrum of how it will shape or misshape the penis. But typically it's just a curvature of the penis, and all men have naturally some curvature to their penis. But Peyronie's really curves it to a point where sometimes men find it very difficult or impossible to have vaginal intercourse.
Right. And it can be uncomfortable too.
Yeah.
Yeah. So it's the tunica. I am not, anybody listening, I am like the worst at pronouncing stuff, and I am totally okay with that. So just, you know, you can laugh, but it's the tunica albuginea. I don't know how to say that properly, but that's like the tissue that we know clinically is affecting the curvature, and it's really a scar tissue formation that's occurring, and it'll cause that curvature. Now there's a lot of different procedures that can be done for this. I would say there's not a lot of great clinical resources and success that we have right now. I think a lot more studies need to be done on this. This is something that we do have men come in for treatment for. I wouldn't say pelvic floor PT has a lot of research to prove that it works, but it is something that we treat, and I do feel like we get decent results. And so a lot of it is going to be breaking up that scar tissue, but you don't want to cause too much tissue damage, because if you do that, you'll cause more scar tissue formation and more of a restriction. So it's really about being gentle with that. We have, if you're somebody listening and you happen to deal with this, we have a really amazing blog post on this on our website that is all research based. And Dr. Jordan Schmidt at our office is the one who wrote that. And it's loaded with really good information. When I read it, I was educated. I was like, wow, this is really cool for me to know. So there's different procedures that typically aren't done by pelvic floor PTs to address this. But since we're talking about this area, might as well kind of hit on that.
Yeah. I think the last thing we wanted to talk about is circumcision.
Yeah, I was going to say, let's go into circumcision.
Yeah. The rates of circumcision are actually going down in the United States. They've been down for a while in many other countries. But Molly, why don't you explain the anatomy of it, and then we'll talk about kind of the necessity of the forceps.
Yeah, so it's so interesting because you're right, things are going down, and that's really awesome. I think that's from an increased amount of education on this. And so I just want to keep this, very much so research based, because everyone's got different things they've done from a cultural or religious perspective with this. And I completely respect that. So a lot of people in the United States will have their son circumcised because they follow what the father is. And if your husband or the father is circumcised, and it's pretty common that then the son will be circumcised. And I know a lot of times I'll hear people say like, oh, I just don't want them to think it looks different from the dads, or like they're going to ask questions. And my answer is always, or my response is always like, why does that matter? It's okay if the penises look different. Like we all look different. And that's great. That's a great conversation for son and dad, I think, to talk about. For me personally, I'm like, let's talk about the differences. But that skin, that foreskin that's cut off, has an insane amount of nerve endings in it that are really important for our sensation and our pleasure. And that foreskin is analogous to the clitoral hood, so that tissue that goes over the clitoris. And if you've ever masturbated as a woman, you know that that tissue, that hood, is extremely sensitive, and it's wonderful to use a vibrator on or to stimulate and so forth. So when we remove that tissue, we are removing actually the ability for the males to experience some pleasure with that. But another thing that I think is important to talk about is, okay, so if you're a lady listening, this is easy for you to maybe understand. If we cut off, I mean, think about how crazy this is though. Like, a circumcision is the same as this for a female, which we would think is nuts if you did this to a girl. But if we cut off the clitoral hood of a little girl, we're like, let's go bring her in. Let's cut off her clitoral hood. I'd be like, what the F? No. But now your clitoris is just like exposed, and it's rubbing on your underwear all the time, and it's rubbing on your pants all the time. What that's going to do is it's going to desensitize it. The nervous system is so adaptable, and it's going to be desensitized because it's exposed. There's nothing covering it anymore. And so that's what happens with men who have been circumcised, is that the head or the glands of the penis starts to become desensitized. And so as men get older, they find it more difficult to have that sensitivity that they're looking for, or to achieve an orgasm and so forth. Whereas a non-circumcised male isn't going to have that concern as they go throughout life, because that foreskin is covering and protecting the glands and not allowing for the desensitization to occur. I don't know if you want to go over anything, Katie.
Well, one argument that I hear a lot, or one, maybe not an argument, but a reason why people feel like it's important to circumcise is for cleanliness.
Oh yeah.
And what I typically say to people like that is, starting at a very young age, you should be teaching your sons to pull back their foreskins and wash under their foreskins, their penis area. And really, if they do that appropriately, there's, not much difference.
Right. So the research on that has shown, it's so funny. It's shown nothing statistically significant for increased infections and risk, whether you are or not circumcised. There is a slight increase if you look at the stats, but it's not statistically significant or clinically significant, as the terms we'll use for it. In fact, you increase a lot of risk when you do have a circumcision for complications to occur. In fact, that risk is higher than the risk that you think you're preventing with infections. And a lot of people don't realize that. So if you look into the research appropriately, it doesn't support that theory at all, of you decreasing infection. So I know that that's an ideology, but it's not supported by the research. Another thing that's so funny to me, and I just have to say this, and I say this to everybody when circumcision gets brought up, I'm like, listen, if a female can keep her vagina and her vulva clean with all the layers and all the flaps and all the tissue and all the mucus and the blood and everything coming out of it, I think a man can keep the tip of his penis clean. Like, come on, dudes. Really? I'm like, do you see all the shit that we're dealing with a vagina? And you can't keep the tip of your penis clean? I mean, come on. Like, I just can't even understand that argument. I'm just like, get over yourself. So, I mean, am I right? Like, think about all this stuff happening in the female anatomy. So, and then I know that with boys, and I actually don't know the answer to this, you're not supposed to pull it back at too young of an age. Like, I think you're supposed to wait until it naturally comes back. Correct? Can you talk more about that? I don't know when that happens for boys.
I think it happens at a different age. I mean, we should probably get a pediatrician on to talk about this, because I'm just speaking from personal experience with my sons. It's weird to say sons. I have two of them now. That's bonkers.
I heard you say that, and I was like, wow.
I know. But we've been told to just let it come back naturally. So, when they're taking a shower or a bath, to have them practice pulling it back, but not to the point where it hurts, but to, keep that foreskin more malleable by continuing to try to pull it back.
When you start doing that, like when you start having your son do that, do you think is appropriate?
When they understood what we were asking I mean, Leaf is our oldest. So when he got to the age where he could understand what we were asking him to do, that's when he started doing it. And now he knows to do it on his own when he takes a bath or a shower.
Perfect. Just like a girl knows to clean her vulva and her vagina, right? And her labia minora area. Like, it's no different. I mean, you clean your armpits, you clean your butt. Like,
yeah, my daughter now gets in the shower and says, I have to clean my vulva and my butt.
Good. I love that. No, it's so good. So that's kind of our last little thing, I guess, that I wanted to hit on with male anatomy is the difference, I guess, between a circumcised and a non-circumcised penis. And just so you all know, they're all beautiful and they're all perfectly fine, and not one is better than the other. And it's also very okay just to leave your penis alone and to not cut anything off of it. It's perfectly structured the way that it is, and it actually has a lot of benefits to the way that it is. Last little thing. Go on.
I said the foreskin serves a purpose in terms of protection, and it also, from what I've gathered, makes masturbation better or easier.
I will say, because I have a lot of males who are circumcised and not circumcised. And when I was having my son, my non-circumcised males were like, you better not get him circumcised. Like, and I've asked all my males who have not been circumcised. I said, do you regret? Because people were like, oh, but what if they want it when they're older? And I'm like, well, then they can get it when they're older. And they're like, it'll hurt. And I'm like, well, at least they made the choice. That was their choice, whatever. So I've said, do you wish that you would have been circumcised? And they're all like, God, no, I'm so happy I haven't been circumcised. For me personally, as a pelvic floor PT. So, I don't know. Why increase risk? And it's also torture. All my friends who had their son circumcised, it has been the most traumatic experience for them when I asked them about it. Like, had real conversations. This is not like just like, another mom at the park. I'm talking about like my close girlfriends had a real conversation about their experience circumcising their sons. And it has been the most traumatic experience for them to go through. And then the upkeep afterwards with diaper changes. And I was like, man, I don't want to deal with that. And I, of course, followed the research for me personally over what I thought was best for my son. But I do understand there's a cultural aspect to this. And so I don't think it's also going to be the end of the world by any means if you do have your child circumcised. But it's important to understand, I guess, the research and don't feel pressured into doing it because that's culturally what you thought you had to do, or you thought it was best to do that because of infection rate.
Yeah. Yeah, that's a really good point.
Okay. Also, my last thing is, I think penises are beautiful, whether they are or are not circumcised. I just have to say that because so many people are like, it looks so gross when it's got the foreskin. And I don't know. I just think I'm weird. I think because I'm a pelvic floor PT, I just think all penises are beautiful. I think all vulvas are beautiful. I just have so non-judgment towards them because I see so many. And it's just the genital region. It looks different on everybody, just like your face looks different on everybody, and your boobs look different and your arms look different. It's just another part of the body. So just love your penis for the way that it is and the way that it looks. And most people hopefully will have that same love and appreciation that you're with. And if they don't, then get rid of them anyways. Anything else you want to add, Katie?
No, I don't think so. I think that was a pretty good, synopsis of the penis. And again, like if you're listening and you have questions, if we didn't talk about something that is of particular interest to you, please write us and let us know, and we will make sure to cover it at a future episode or give it its own episode if it's a big enough topic.
Yeah, absolutely. Okay. Thank you all for listening. Again, if you like our podcast, please share our episodes, subscribe, send these little cute, fun messages with whatever emojis you want about you can put for this one, the best one would be the eggplant. Just send it out there with the eggplant to your friends. Let them listen, learn some penis and testicle anatomy. And thank you again for listening, and we'll see you at the next episode. Bye.
We are Dr. Molly Hart and Dr. Katie Schubert, and you've been listening to Sex on the Floor podcast. We really hope that you enjoyed this episode. If you have any questions and want to get in contact with us, you can follow us on Instagram at Dr. Molly Hart and at Dr. Katie Schubert, on Facebook at Pelvic Balance PT and at Dr. Katie Schubert. And for more information about us on our websites, you can find us at pelvicbalancept.com and at drkatieschubert.com.